Clinicians in pediatric and congenital cardiology often are confronted with patients who have tattoos or piercings. And the question is this dangerous for them? Sometimes they also got questions from patients who consider future piercings and tattoos. This is what I would like to address in this presentation. I have no disclosures for this presentation, except that I don't have any tattoos or piercings, so this picture is not even mine. Tattoos are considered as a characteristic of modern society. However, the oldest evidence of tattoos in humans goes back 5,000 years. This is Ötzi. This is the Iceman that was found on the border between Italy and Austria, and on his body overall 61 tattoos have been found. So this means that tattoos is not a new thing. Most people are having tattoos as a way of self-expression, as a way to make themselves even more unique. And other people, they choose to have tattoos of the people that they adore. In this presentation, we are talking about people with congenital heart disease, and we address the question, is having a piercing or a tattoo detrimental for these patients? Spontaneously, we think about bacterial endocarditis. And indeed, looking in the medical literature, we found overall 5 cases in patients with congenital heart disease who developed bacterial endocarditis after tattooing. However, these cases had to do with people with extensive tattoos, with multiple tattoos, or with suboptimal aftercare. In these 5 cases, one death was observed. Regarding piercing, in the medical literature, 19 cases have been described of people developing endocarditis after piercing. 8 of them had to do with a piercing in the tongue or the oral zone, 4 in an ear, 4 in the navel, 2 in the nose, and 1 in the nipple. These 19 cases were not only people with congenital heart disease. Indeed, 4 of them were known with a murmur, but only 3 out of the 19 had a confirmed congenital heart disease. These are all case studies, and therefore we know that this gives us an underestimation of the real occurrence of endocarditis after piercing and tattooing. However, it helps us to put things into perspective. From different international studies, we know that 10 up to 25% of the inhabitants do have a tattoo. If we transpose these data to Europe, it is estimated that about 100 million individuals do have a tattoo. Regarding piercing, the numbers are even higher. There, it is found that up to 50% of the population do have 1 or more piercings. Knowing the high number of people in the community with having a piercing or a tattoo, and knowing that about 1% of the population do have a congenital heart disease, it gives you an indication that the incidence of endocarditis in our patient group is relatively low and therefore can be considered as rather coincidental instead of causal. We also need to look at other effects of tattooing and piercing, and for instance looking at the toxicological impact of it. In this respect, we are thinking about the dyes. The good news is that the dyes nowadays are using organic pigments. This is different with the dyes used some decades ago. However, even with contemporarily used dyes, the colorants comprise detrimental components such as titanium, barium, aluminium and copper. And also these dyes do have contaminants such as antimony, arsenic, cadmium, chrome, cobalt, lead and nickel. These are heavy metals. And irrespective of the fact that the dyes are considered to be sterile, excessive bacterial counts have been found in 20% of the inks. Admittedly, professional parlors are using the American dyes, which are of higher quality compared to the cheaper Asian dyes. What are the cutaneous complications that occur after tattooing? The literature indicates that 2 up to 27% of the people having a tattoo present with cutaneous complications. These complications pertain acute complications such as disabling sterile edema, acute transient lymphadenopathy, acute contact dermatitis, acute pyogenic infection and tattoo blowout. This latter is of permanent character. There are also cutaneous infections and warts observed, allergies to pigment and dyes, and in this respect it is mainly the red and the violet color that seems to provoke most allergies. Dermatosis are observed as well. Sarcoidosis is one of them, which seems to be linked to the black ink. And finally, skin tumors have been observed. For instance, when a nevus is included in a tattoo, it can be triggered to become malignant. However, the incidence of skin tumors is still low and therefore is also considered to be coincidental. This figure is an overview of the distribution of the different cutaneous complications. 1/3 are allergic reactions, 14% are non-allergic reactions, 11% bacterial infection, 8% systemic reactions, and 1/3 is other. Regarding the prevention of infections, it is obvious that a tattoo should be performed by a professional tattoo parlor. However, a survey among American people indicated that 17.6% had their tattoo placed by a non-professional tattoo parlor. Obviously, this puts them at risk for developing infections. There are also systemic complications, and as I indicated before, there are cases described about sepsis, endocarditis and uveitis. However, the incidence is low and therefore is considered to be coincidental. The question in this respect is also, is there a need for antibiotic prophylaxis? Well, a survey among congenital cardiologists indicated that most congenital cardiologists would recommend prophylaxis. However, there is no evidence to support this practice, and we do not know if antibiotic prophylaxis has a value in this respect. In almost all people with tattoos, the lymph nodes are affected. Pigments can be found in the lymph nodes, and therefore sometimes the lymph nodes are even palpable. For women with tattoos, pseudoaxillary calcifications can be found on a mammogram. However, the most frequently occurring complication seems to be regret. Indeed, 16.2% of the people with a tattoo seems to regret that they have this tattoo. This is clearly linked to the age on which the tattoo has been placed. When the tattoo is placed in people below the age of 17, 35% regrets. When the tattoo is placed between the age of 18 to 20, 13.6% regrets to have the tattoo. And when the tattoo is placed at the age older than 21, 11.4% regrets. And these figures make even more sense if you know that 21.2% of the people got their tattoo placed while they were intoxicated. A notorious example of this in Belgium is this girl, who woke up on a Sunday morning with a face like this, not knowing what happened the night before. These were all issues related to piercings and tattoos in people with congenital heart disease. There are also some additional aspects that I would like to address. Numerous of our patients undergo MRI on a regular basis. There have been cases described in which burn injuries occur at the tattoo place after undergoing an MRI. So if we counsel our patients, we should bear this in mind and we should give information on this potential extra complication for these patients. Second, some of our patients are having a tattoo to hide a scar from a previous heart operation. Indeed, we all know patients who are really suffering from having this scar. A tattoo could be a solution. The question, however, is what will happen when reoperations are needed? When the cardiac surgeon needs to access the heart through the tattoo. What is happening from a toxicological point of view, but also what is happening with the design of the tattoo. And maybe the things are worse than before the tattoo. Talking about the specifics of tattoos and piercing in people with congenital heart disease is one thing, but we also need to give them more general advices, such as choose a parlor who is not dyslexic, who has a basic sense of geography and who has a good taste. Let's come to the conclusion. Cases about bacterial endocarditis have been described in the medical literature. However, the link with tattoos and congenital heart disease is rather coincidental instead of causal. The risk of developing an endocarditis has more to do with the size, the location and the hygienic conditions under which the tattoo or the piercing has been placed. The value of antibiotic prophylaxis is largely unknown. Finally, when we are counseling our patients, we should not only focus on endocarditis, but also include cutaneous, systemic and societal impact. Thank you.